we will discuss the cranial cavity and the foramina of the skull. As usual, welcome all. My name is FOSSAE and I'm the Daktari. So, let's start. Okay. So, what are some expectations? So, by the end of this session, I expect you to, one, state the boundaries of the various cranial fossa. So, second, you identify various foramina on the skull. And thirdly, tell me the contents of these various foramina. So, let's start. This is a lateral view of the human skull, what is known as the NORMA lateralis. So, we want to visualize the internal of this skull. So, we cut it along that plane, and then we view it from that view. So, when you do that, this is what you see. You see three depressions in the internal of the on the internal part of the skull base, and these depressions are what are referred to as the cranial fossa. Okay, so the anterior one, middle, posterior. Now let's start with the anterior cranial fossa. Discuss its boundaries. So the anterior cranial fossa, it is okay. So please allow me to hide this for a minute. Okay, let us give time for this to disappear. Yeah. So anterior and laterally, we have the frontal bone there. Anterolateral boundary is the frontal bone. Okay. And then posterolaterally, here you have the lesser wings of sphenoid. There, posterolaterally. And then posteromedially, we have this part. And this part, which is the anterior margin of this sulcus chiasmaticus, is actually what is known as the limbus of the sphenoid. Okay. Yeah. And then this part, the floor, will actually be formed on the lateral part of the floor will be mainly be formed by the orbital plate of the frontal bone. The orbital plate of the frontal bone. Now this actually forms the roof of the orbit. The orbit will be down, or inferior to this. Okay. And then medially you have the ethmoid bone, and on the ethmoid bone you actually have what is this upward projection known as the crista galli, and that crista galli is actually what forms the attachment, the anterior attachment of the falx cerebri. Okay. And then posteromedially, the floor will be formed by this part known as the limbus. It's the sorry, this is the jugum. Okay, this is the jugum of the sphenoid bone. Okay, the jugum there. So the jugum is that part of the body, or that part of the sphenoid which connects the two lesser wings. Okay, so that is the story for the anterior cranial fossa. We will discuss it foramina in a few. So let's move to the middle cranial fossa. So what we said as the posterior boundary of the anterior cranial fossa is the anterior boundary of now this middle cranial fossa. So we have the lesser wing of sphenoid, the limbus, okay, and then the posterior boundary of the middle cranial fossa, which will now be in turn the anterior boundary of the posterior cranial fossa, will be formed by the superior border of the petrous temporal bone and the dorsum sella. Okay, the dorsum sella there. And then the floor of the middle cranial fossa, medially you have what is known as the body of sphenoid. But this body of sphenoid has some structures. One, you have the sulcus chiasmaticus there. So that is the optic canal in that one. So this groove joining the two is the sulcus chiasmaticus. And then we have a ridge posterior to the sulcus chiasmaticus, that is the tuberculum sella. Then you have this deep depression, a depression posterior to the tuberculum sella, that is known as the hypophyseal fossa. And then this ridge posterior to the hypophyseal fossa is the dorsum sella. So the dorsum sella, hypophyseal fossa, and the tuberculum sella, collectively, they are known as the sella tussica. Okay, sella tussica. Now, we have this lateral projection on either side of the dorsum sella. That is the posterior clinoid process. Now, the posterior clinoid processes are actually they form attachments. It is one of the attachment of the attached body of the tentorium cerebelli. Now, these are the anterior clinoid processes. These are the medial projections of the lesser wings of sphenoid, and they are actually they form attachment of the free border of the tentorium cerebelli. Okay. Now, on the lateral part of the floor of the middle fossa, we have mainly the greater wing of sphenoid, the squamous part of the temporal bone, and the petrous part. Okay, the anterior surface, that is, because the posterior surface of the petrous temporal bone is actually in the posterior fossa, and that is the story of uh, the middle fossa. Now, onto the posterior fossa. Here, the posterior fossa, the anterior boundary will be the posterior boundary. Its anterior boundary is the posterior boundary of the middle fossa, as said earlier. So that it will be the superior border of the petrous temporal bone and the dorsum sella over there. And then the posterior boundary will be mainly the internal surface of the occipital bone. Okay. Then the floor will have the posterior surface of the petrous temporal bone, the internal surface of the occipital bone, and we have some contribution from the parietal bone. Okay. Now we have these parts here, which is actually known as the cleavers. So the cleavers is actually formed by two bones. Okay. So I'll be showing you the two bones which form the cleavers. So these are the bones in forming the various floors of the various cranial fossa. Okay, you have the ethmoid bone there, the orbital plate of the frontal bone. This is the sphenoid bone, the lesser wings there, the greater wings, and the body there. So this is the part, the cleavers. So the cleavers is actually formed by the body of sphenoid, see up there, and the basilar part of the occipital bone. Okay, so the basic occiput and the body of sphenoid. So you can see this joint, the spheno-occipital joint. That joint is a primary cartilaginous joint. So it is a synchondrosis. Okay, and it is immovable. Okay, it is non-mobile. Yeah, so those are some of the bones in the various cranial fossae, and let's discuss now these openings of the foraminas. Okay, now let's start with the anterior cranial fossa. In the anterior cranial fossa, you have that. Now that is the opening between the frontal bone. So this is the frontal bone found at the junction between the frontal bone and the ethmoid bone. So that's the foramen cecum. So the foramen cecum in a small population, it usually has an emissary vein from the nasal cavity towards the superior sagittal sinus. Okay, and then that I told you is the crista galli, and remember what I was attaching there. Now those are the cribriform foramina through which olfactory nerves pass through. Okay, so they pass from the nasal mucosa or the olfactory mucosa, actually from the olfactory mucosa found at the roof of the nasal cavity, and they move to the olfactory bulb. So olfactory bulb will be lying on the surface of the cribriform plate. Okay, and then that, as I had told you earlier, is the jugum sphenoidale. Okay, the jugum. Now on to the middle cranial fossa, we have the optic canal. That's the left one. That's the right one. And then you also have the superior orbital fissure. So those two open into uh, the orbit, and we will discuss that separately in the next slide, I believe. Now that's your foramen rotundum, and through that, the maxillary division of trigeminal nerve passes there. That's your foramen ovale. So we have four structures which pass through the eye, and that is the mandibular division of trigeminal nerve. You have the accessory meningeal artery from the first part of maxillary artery. You also have the lesser petrosal nerve, which is connected to glossopharyngeal nerve. And you also have an emissary vein. So this emissary vein will connect to the cavernous sinus, which will be somewhere here, either side of the body of sphenoid, to the pterygoid venous plexus, which will be actually in the temporal fossa. Okay, and then posterior and lateral to the foramen of vein. So posterior and lateral, somewhere there, will be your foramen spinosum. So foramen spinosum, usually through the foramen spinosum, the middle meningeal artery and the nervus spinosus, they pass through there. Okay, so the nervus spinosus can also be named as the recurrent meningeal branch of mandibular nerve. Okay, and it usually supplies the dura of the posterior half of the middle cranial fossa. Okay, then in some instances, actually, between foramen of vein and foramen spinosus, you can have a opening known as the canalis innominatus. So that's a variant anatomy. And if the canalis innominatus is present, actually the lesser petrosal nerve will pass through the canalis innominatus. Okay, now that's the story for the middle cranial fossa. Now on to the posterior cranial fossa. We have one, the internal acoustic meatus. So through the internal acoustic meatus, the facial nerve, so the facial nerve proper, or the motor root of facial nerve, will pass through there. And so with the sensory root of the facial nerve. So the sensory root of facial nerve is the nervus intermedius of Risberg. Okay, and also you have the vestibulocochlean nerve passing through there, and the labyrinthine artery, which came from the anterior inferior cerebellar artery, which came from the basilar artery. Okay, and then you have the jugular foramen there, big. So the jugular foramen has three parts. Okay, it's usually divided into three parts. So an anterior part, a middle part, and a posterior part. So in the anterior part, you have the inferior petrosal sinus. In the middle part, which is the nervous compartment, you have the glossopharyngeal, vagus, and accessory nerves passing through there. And in the posterior compartment, you have the sigmoid sinus actually passing through there before actually at this point the sigmoid sinus, after passing through there, it changes its name to the superior bulb of internal jugular vein. Okay, and then you have the foramen magnum there, which we will discuss extensively because it has two compartments, and hypoglossal canal through which the hypoglossal nerve passes. Okay, so those are just some various foramina. Please be able to identify them. Okay, the way I find, so the way to identify these things is you go into the actual lab, take this skull and try to identify them using your atlases, and it might take some time for you to actually get the names and the contents. At first it might seem much, but trust me, with time you become better. Things don't become easier with time, but rather you become better. Okay, so these are the contents which were passing into the orbit through the optic canal and the superior orbital fissure. Now, those structures which pass through the optic canal are the optic nerve and the ophthalmic artery. Okay, now these two pass through this ring known as the common tendinous ring. So this common tendinous ring is a ligamentous structure from which the straight muscles of the eye take origin. So the straight muscles of the eye are the recti muscles. Okay, so we have some structures which pass through the superior orbital fissure here. Some pass outside the ring, the common tendinous ring, while others pass within it. So those which pass through the ring include the two divisions of oculomotor nerve and one branch of ophthalmic nerve, which is the nasociliary nerve, and the abducens nerve. Okay, those which pass outside include the two branches from ophthalmic nerve, that is lacrimal nerve and frontal nerve, and the trochlear nerve actually passes outside the common tendinous ring. The ophthalmic vein, the superior ophthalmic vein, also passes outside the common tendinous ring. So as an assignment, go and find out which artery will pass through the superior orbital fissure. Somewhere here where my pointer is, So it will be outside the common tendinous ring. Which artery? Find out that. Okay, that's foramen magnum. I told you it has two compartments as shown here, an anterior compartment and a posterior compartment. The anterior compartment is mainly ligamentous and posterior compartment is mainly neurovascular compartment. So in the anterior compartment, you find the apical ligament of dens, which moves from the apex of the dense process of the odontoid process of the axis, and passes upwards to be attached somewhere along the anterior margin of the foramen magnum. Behind that, you have the apical longitudinal band of the cruciform ligament and the membrana tectoria. So the membrana tectoria, or the tectorial membrane, is considered as the upward continuation of the posterior longitudinal ligament. Okay, so from the posterior aspect of the body of axis to the basic occiput. Okay, then in the posterior compartment, the neurovascular compartment, you have the medulla. Okay, the lower part, some consider spinal cord. Okay, and the vessels, and that is the anterior spinal artery, the two vertebral arteries, and the posterior spinal artery. But also you have the spinal root of accessory nerve. So this spinal root of accessory nerve originates from the cervical segment C1 all the way to C5. Okay, so it will pass through the foramen magnum, and then it will be joined by the cranial root, which will come from the brainstem, and then as the accessory nerve, now they exit the skull from the via the jugular foramen. I'll be showing you that. Okay, now this is the base of the skull, or the NORMA basalis. So that's the foramen ovale, that's the foramen spinosum. Please remember what passes through there. And then that's the carotid canal. So through the carotid canal, you have the internal carotid artery and the carotid plexus, the sympathetic plexus around that artery. Actually, that sympathetic plexus usually form what is known as the deep petrosal nerve, and the deep petrosal nerve will be joined by another nerve to form the Vidian's nerve. Okay, we'll be taught that when you discuss the pterygopalatine fossa and the connections of the pterygopalatine ganglion. And then that's the foramen rastrum over there, foramen rastrum. So the greater petrosal nerve will be seen passing over it, not through it, over it. Okay, the greater petrosal nerve. Okay, and then that is the master process. Okay, that's the styloid process, and then you have a foramen in between the two. So name it. So it is the stylomastoid foramen. So the stylomastoid foramen, through that you have the fascial nerve and the stylomastoid artery and vein passing through there. Okay, and then we have this fissure here between the petrous part of the temporal bone and the tympanic part. Okay, so that's the petrotympanic fissure, and through the petrotympanic fissure you have the chorda tympani. So the chorda tympani is related to the fascial nerve, passes through there, and also the anterior tympanic artery from the first part of maxillary artery. Okay, now this is the front view of the skull, or norma frontalis. So one you have that's the supraorbital. In this point is a foramen. So others have a notch, others a foramen. So this is a foramen, and through there the supraorbital nerve and vessels pass through there. And then that's the infraorbital foramen. Through there you have the infraorbital nerves and vessels passing through there. Remember, the infraorbital artery is one of the branches from the third part of maxillary artery, and the infraorbital nerve is actually the terminal branch of maxillary nerve. Okay, and then that's your mental foramen there. So the mental foramen, you have the mental nerve and vessels passing through there. So the mental nerve and vessels are actually terminal branches of the respective inferior alveolar neurovascular structures. Okay, then somewhere here, I believe you'd find the zygomatic-facial foramen, through which the zygomatic facial nerve and vessels pass through. Okay, so that one I did not indicate, but I'm sure. Please identify it when you go to your dissection sessions. Okay, now these are just some cranial nerves, and I want to show you those cranial nerves. So that one there, this one, that's your optic nerve, that point. Then that's your internal carotid artery. Okay, And then that one is none other than the oculomotor nerve. Okay, and then that is your trochlear nerve. Okay, and then that one, big one, that's your trigeminal nerve. And you can see the trigeminal nerve actually is entering a cave. Okay, that's what is known as the Merkel's cave, the cavum trigeminale. In here, you find the trigeminal ganglion. Okay, trigeminal ganglion, that point. And then that's your abducens nerve. So abducens nerve ascends on the clevus, and then at the apex of the petrous temporal bone, it will pierce there before into a canal known as the Dorerus canal, and then enter the lateral wall of the cavernous sinus. Okay, so that's abducens nerve. And then that is the motor root of the facial nerve, or the facial nerve proper. And then that one is the sensory root of the facial nerve, so the nervous intermediates of Frisberg. Okay, and then this one is actually the vestibulocochlear nerve. Okay, vestibulocochlear nerve. Then that is the glossopharyngeal. That's vagus. That is accessory. Okay, and you can see accessory is entered in the skull, or the cranial cavity first via foramen magnum. So this is the spinal root, and then it will be joined by a cranial root, and then they exit via jugular foramen there. And lastly, that is your hypoglossal nerve. Okay, that's your hypoglossal nerve. Okay, and then this here would be the infundibulum of the pituitary gland. Okay, and then you can see this dural enfolding on the actually forming the roof of the hypophyseal fossa. That is what is known as the diaphragma cella. Okay, diaphragma cella there. Okay, so maybe some impressions. So that impression here on the superior border of the petrous temporal bone will be formed by the superior petrosal sinus. You can see this is the transverse sinus. Okay, and then you can see the point the two met to form this. This is the sigmoid sinus, and you can see it passing headed towards the jugular foramen. Okay, here it is. There it is there. Okay, okay. So we will discuss this story of the sinuses in another video, but for now, I have nothing more to say apart from thank you, and do subscribe for more anatomy content. Thank you.